In this week's Monday Motivations, brought to you by Gates Brain Health, we have Dr. Randall Gates, a board-certified chiropractic neurologist and chiropractic physician, back here with us. And we're talking about memory loss, but we typically talk about memory loss when it comes to Alzheimer's and dementia.
Right.
Now we're going to talk about it in terms of those repeated head injuries.
Correct. So, for example, a lot of patients who have Alzheimer's may not think, or if they have minimal cognitive impairment, the stage before Alzheimer's, which can last many, many years, may not think of previous head injuries as being important. And they absolutely can be. So we know that previous head injuries can predispose someone to a memory degenerative condition, we'll say it that way, something like Alzheimer's. But now we have the whole component of chronic traumatic encephalopathy as well. And lots of times people are wondering, how do I differentiate one from the other?
And what you just said there, is that CTE that we typically hear about and stuff like with sports injuries? Obviously football, big time right now for that. A lot of people getting, out of the game because of concussions. So that's kind of an obvious one. We think of athletes getting these kind of head injuries that are really severe. Are there other types of head injuries that can happen, or other causes of them?
Other causes of the head injuries are, well, what I would say is that relative to CTE, I think it's important that we say it is a post-mortem diagnosis. So we really don't know if somebody has that until that autopsy. Now, that doesn't mean that researchers are not trying to figure out, can we predict who will develop CTE? We know with CTE that repetitive concussive or subconcussive head impacts can almost be, if not more important than just concussions, not just, but than concussions. And with that being said, the research is really trying to look into ways we can predict who will develop CTE or not. And some of that research is looking at the density of different areas of the brain. I've talked about that before. But the research is evolving such that now we might be getting to a point where we can start to say, can we begin to differentiate those who look like they're going towards Alzheimer's versus those that are going towards CTE?
Interesting.
Based on the patterns of loss of density in the brain.
Okay. And so does that come from, you're looking at maybe causes, or are you looking at symptoms? Are we looking before and stuff, or after? How does that work?
Great question. So in terms of symptoms, one of the things we can look at is that with CTE, there tends to be a lot of irritability, rage, impulsivity, a lot of depression, what we call emotional lability, so moods moving all around. You can see certainly some of that with Alzheimer's, but more with Alzheimer's we're seeing the memory loss, confusion, and the significant emotional symptoms are not as pronounced early on. So in terms of symptoms, that's what I'd say there. In terms of causation, both repetitive head impacts and concussions, if a concussion is going to lead towards Alzheimer's, we can say it's bad for the memory area. Repetitive head injuries are also bad for the memory area, but they also cause what's called phosphorylation of tau protein throughout the brain, not just in the memory area, but particularly in the frontal lobes.
And so as you are maybe experiencing some memory loss, when you go to talk to your doctor, what are some of the things that are important to bring up and stuff 100%. As far as things like that goes? Because you may not even know that a head injury in your past, you know, from years ago, could be an effect of this. Yeah,
I think that's a great point. So I think highlighting all the symptoms that a person is experiencing, not just I'm losing memory, but are there emotional symptoms? Are there hallucinations, as I talked about on a previous broadcast on YouTube? So if a person's having hallucinations early in the course of their memory condition, it might indicate something called dementia with Lewy bodies. And so highlighting all the symptoms that not only that person is observing, but loved ones particularly, are really important to talk to your doctor about.
Yeah, even if you think they're just like, oh, I'm just getting older, or you know, you think of them as inconsequential because they're not the more serious one or the most obvious one, kind of being able to talk to them about everything is important. Okay, well that is so good to know. If there is anybody else has any questions out there that you want to ask Dr. Gates, where can people find you?
775-507-2000, gatesbrainhealth.com, and I have my YouTube page, so you can search on YouTube for Gates Brain Health.
Perfect, and I'll make sure there are links to that on our website, colatv.com. So Dr. Gates, thank you so much for being here. That was really interesting.
Thanks
Appreciate it.
As always, yes.
All right, thank you guys for watching. We'll be right back after this quick break.